Who knows what the sacroiliac joint is or the SI joint? So I want to explain a little bit about what that is. So the SI joint is where your sacrum, which is your coming into your tailbone here, attaches to your ilium, which is this pelvic bone here. So where these two joints attach, that's called your sacroiliac joint or your SI joint. So what a lot of people don't realize is back pain is a very, very common thing. But a lot of people end up with back pain that are specifically happening at that SI joint. So people can develop all kinds of different back conditions, back issues, herniated discs, spinal stenosis, arthritis in the joints, all kinds of alignment issues in the spine, muscle issues that can lead to back pain. But a lot of times people have very specific problems right at this SI joint. And this SI joint can get kind of nasty. So sometimes what happens is our SI joint is covered with a lot of ligaments that cover across both areas here that attach to the sacral bone, which is this bone right in here. So what's happening is sometimes the ligaments get very, very tight along with all the muscles around there and won't allow movement to occur. So movement occurs across these joints in a couple of different ways. They can rotate back and forth, they can slide up and down, or the pelvic bones can rotate in and out. So you get independent movement that occurs on both of these spots on the pelvis while it attaches to the sacrum. And that can cause irritation across here. Your sciatic nerve travels down through here, and that also can get pinched as it's coming out of your spine at this level here. So you have a lot of different areas that can get irritated in this spot. So a lot of times what I see when people are dealing with SI joint issues is one is either there's too much mobility going on there. It's almost hypermobile. It's kind of moving in and out too inconsistently, and that extra movement can create irritation and pain. Other times, people will have one side that's really locked up and won't move at all, and the other side has to compensate and do all the moving. A lot of times what will happen is an indicator will be a leg length difference. So one leg might be shorter than the other. And that naturally will happen as this pelvis rotates. It'll lift one leg up, making that leg a little bit shorter on the one side. So a lot of times what we'll do is we want to work on building up and stabilizing all the muscles across the lower back into the hip region, into the glutes, into the anterior part of the hips and pelvis, and try to get everything stabilized and strong there to maintain stability on that joint. So if you're having some back problems, it could be a whole lot of different reasons. But one of the things it could be is your SI joint. So the other aspect that comes along with this is our posture in our lumbar spine and how our spine is designed, whether it's curving back too much this way or curving in too much this way. And that will affect exactly how that pelvic position is associated. So if you have any problems with your back, let us know and call a PT.